Okay, let's unpack this. When you hear about the humanitarian crisis in Gaza, it's easy to feel overwhelmed, right? But what does that really mean on the ground for the people living through it? And maybe what are the most crucial facts you need to know to be, truly informed? Today, we're doing a deep dive into Gaza's humanitarian crisis, beyond the headlines. Our mission, really, is to pull out the most important nuggets of knowledge and insight from a whole range of sources. Think detailed reports from humanitarian groups, international bodies, even political statements. We want to give you a clearer picture, maybe with some surprising facts, and just enough context to sort of connect the dots.
It's important to say this is a topic filled with just immense human suffering and, frankly, deeply conflicting narratives. Our aim here is to synthesize the information from the sources we've looked at, presenting the reported facts and the different viewpoints as impartially as possible, so you can hopefully understand the situation a bit more thoroughly.
Right. Let's start by setting the scene. The widespread destruction and that immediate human cost. Reports from just the war's first month alone were harrowing. You had the UN Secretary General stating Gaza had become a graveyard for children after reports mentioned over 4,000 children killed. And even as recently as May 2024, Samantha Power, who heads USAID, noted that conditions were actually worse than ever before. The scale of displacement and the destruction of homes, it's been devastatingly rapid. Just think about this. By October 10th, 2023, you had over 423,000 Palestinians displaced and 1,000 homes destroyed, with over 500 basically uninhabitable.
And just 5 days later, that number, the displacement figure, it soared to an estimated 1 million people. Many had fled northern Gaza after the Israeli evacuation orders came through.
Yeah, but then because of heavy bombing in the south, some of those refugees reportedly ended up moving back towards Gaza City. It's just incredible.
Absolutely. And by late October, reports suggested nearly half of all homes in Gaza were destroyed or damaged beyond use, leaving, an estimated 1.4 million people homeless.
And fast forward to January 2024, the picture gets even worse. Reports indicated maybe 70 to 80% of all buildings in northern Gaza were damaged or destroyed. And by the end of that month, at least half of all buildings across the entirety of Gaza had suffered that same fate.
It's staggering. The Red Cross back in October 2023 already said rebuilding all this destroyed infrastructure would take years.
So what does this actually mean for daily life? The living conditions for the displaced must be, dire.
Exactly. By October 21st, 2023, UNRWA, that's the UN Agency for Palestinian Refugees, reported 500,000 people sheltering in their facilities. And they described conditions even then as untenable.
Wow, 500,000.
And that number jumped to over 670,000 by the end of October. Plus, in many others sheltering in hospitals wherever they could find space.
I remember seeing reports.
Yeah, an Al Jazeera journalist in November 2023 described southern Gaza starkly as a large concentration camp. You hear accounts of maybe 15 people crammed into a single tent.
15 people?
Yes. And by January 2024, the city of Rafah, its infrastructure was just completely overwhelmed at its breaking point because of this massive influx of people.
And there are other disturbing reports too, weren't there? About homes being deliberately targeted.
Yes. In February 2024, Gaza's information office stated the Israeli Defense Forces were deliberately burning homes.
The numbers, they just tell a story of immense human suffering and loss, really on an unimaginable scale. It's truly difficult to grasp the full extent of living in those conditions. So, okay, with all this devastation, what does it mean for the most basic necessities? Let's talk about access to water and food.
Well, the collapse of the water system is a critical issue with cascading effects. Doctors Without Borders stated back in December 2023 that Gaza's water system had effectively collapsed.
Completely collapsed.
That's what they said. And UNICEF reported children in southern Gaza were getting only about 1.5 liters of water a day. The minimum amount needed just for survival is 3 liters.
Half of what's needed.
Barely half. And the only water desalination facility in northern Gaza was apparently inoperative by December 2023.
Right.
A CSIS report from November 2024, that's the Center for Strategic and International Studies, it highlighted that out of nearly 600 key water and sanitation facilities, 37 were confirmed destroyed, and over 200 had suspected damage.
That includes major infrastructure then?
Yes, even the UNICEF and EU-funded desalination plant in the north, which provided something like 14% of potable water, it was damaged, as were the Gaza Central wastewater plant and its solar field.
And there were warnings about long-term damage, too, weren't there, with the tunnels?
That's right. Experts warned that Israel pumping seawater into tunnels could actually cause irreversible damage to Gaza's underground water aquifers, which are, a vital source of clean water.
So what are people drinking?
Well, reports indicate Gaza residents were drinking water contaminated with sewage, with seawater, even farm water, simply because clean sources weren't available.
So it's not just the lack of water, but the quality. That's deeply disturbing. And it raises a critical question. What are the wider health consequences when people are forced to drink contaminated water?
Exactly. And the food situation is equally dire. The population is considered at high risk of famine, driven by airstrikes and the blockade preventing basic essentials and humanitarian aid from getting in consistently.
Airstrikes hitting food supplies directly.
Yes, destroying crucial infrastructure like bakeries, mills, food stores. You had a group of UN experts state in July 2024 that what they termed Israel's targeted starvation campaign had spread throughout Gaza, leading to child deaths. Now, Israel criticized that claim as misinformation, it's important to note.
Okay.
But the impact is measurable. Childhood malnutrition in northern Gaza reportedly increased by 300% just between May and July 2024.
300%, that's staggering.
It is. Aid organizations like Oxfam are trying to help, of course. They're assisting over 71,000 people with electronic food vouchers. And many residents, like one named Mwar, quoted in reports, describe these vouchers as literally bringing life to my family.
It's just such a stark picture, isn't it? When people rely entirely on vouchers for their most basic sustenance, this feels so far beyond just a headline. It's a daily, grinding battle for existence. And okay, beyond hunger and thirst, this breakdown of basic services, it must create a terrifying breeding ground for disease, right? And lead to a collapse of healthcare.
Absolutely. The spread of infectious disease became a major concern very quickly. The World Health Organization, the WHO, warned back in November 2023 about intense overcrowding and the disruption to health, water, and sanitation systems posing a real danger for the rapid spread of diseases.
Like what kinds of diseases?
Well, Oxfam and the UN specifically warned about a rise in cholera and other deadly infectious diseases, mainly due to that lack of clean water and proper sanitation. Sewage pumping stations stopped working. Wastewater treatment plants ceased operations. You end up with a buildup of solid waste, even unburied bodies, all acting as potential vectors for disease.
But there was a specific, really alarming development recently.
Yes, poliovirus was detected in Gaza's sewage water in July 2024, and then a polio epidemic was officially declared on July 29, 2024.
Polio in 2024.
Indeed. And beyond infectious diseases, there's the impact on chronic conditions. A study citing nearly 100 American healthcare workers who'd served in Gaza estimated that at least 5,000 people died just from a lack of access to care for their existing chronic diseases.
Wow. It just starkly illustrates that compounding effect, doesn't it? How infrastructure, failure, water, sanitation, electricity, it all cascades and directly fuels this widespread health catastrophe.
And the healthcare system itself, as you mentioned, has collapsed. Hospitals face critical fuel shortages early on, relying on backup generators. By late October 2023, some, like the Indonesia hospital, just began shutting down entirely.
And the human cost of that was immediate.
Tragically, yes. When hospitals lost power completely, reports emerged of multiple premature babies dying in neonatal intensive care units.
Oh, that's horrific.
It is. And medical staff were killed, ambulances, health institutions, medical HQs, multiple hospitals were destroyed. Doctors Without Borders stated scores of facilities were damaged.
So when did they say the system actually collapsed?
By late October 2023, the Gaza Health Ministry stated the healthcare system had totally collapsed. And Doctors Without Borders was even more blunt by January 2024, saying there is no longer a healthcare system in Gaza.
No longer a system at all.
The WHO reported over 300 attacks on healthcare facilities, resulting in over 600 deaths by January 2024. And by mid-January, not a single hospital in Gaza remained fully operational.
Not one.
Not one fully operational. The UN Development Program even estimated in May 2024 that the conflict could push health levels back to where they were in 1980.
Back to 1980 levels.
The Red Cross described Gaza's entire health system as being on its knees, and Doctors Without Borders noted conditions were akin to World War I.
The stories coming from the ground. One American doctor described Al-Aqsa Hospital as the stuff of nightmares. And the WHO chief just stated it's inconceivable that healthcare protection isn't assured.
And the impact on children specifically has been just disproportionate and devastating. You look at the figures. Save the Children, UNICEF, Palestinian health officials reported that by mid-April 2024, an estimated 14,500 children had been killed in Gaza, with thousands more believed buried under rubble.
14,500.
The UNICEF deputy director called the conditions for children the most horrific he had ever seen in his career.
And there were reports comparing this conflict to others.
Yes. Oxfam and Action on Armed Violence reported in late September 2024 that the number of children killed in Gaza over the past year was actually the highest recorded in a single year for any conflict worldwide in the last 20 years.
The highest in 20 years worldwide.
That's what the report stated.
Yeah.
UNICEF said back in December 2023 that Gaza was, by far, the most dangerous place in the world to be a child. They calculated more children were killed there in just 2.5 months than in all conflicts worldwide over the previous 3 years combined.
It's almost impossible to process those numbers.
And tragically, a specific term has emerged from this, WCNSF. It stands for Wounded Child No Surviving Family.
Oh my goodness.
And beyond the deaths, many children are left with permanent disabilities, amputations. One report indicated that over 10 children a day were losing a limb during just a 3-month period alone.
This is truly heartbreaking. What about the psychological toll on these children and the specific challenges for mothers?
The psychological impact is profound, as you'd expect. Weeks of continuous airstrikes, explosions. It contributed to what reports describe as the psychological destruction of children. Symptoms included things like convulsions, aggression, bedwetting, extreme nervousness.
You saw studies on this.
Yes, one indicated 90% of children in pediatric hospitals showed or reported symptoms of anxiety, and 82% reported fears of imminent death.
82% feared they were about to die.
The WHO reported back in November 2023 that 20,000 people needed specialized mental health services, and by January 2024, nearly 500,000 people had experienced disruption to their care.
And for mothers,
The challenges are immense. Reports suggest miscarriages in Gaza increased by 300% under the Israeli bombing. UN Women reported in January 2024 that 2 mothers were being killed each hour in the conflict.
2 mothers an hour.
And those premature babies we mentioned, they faced enormous risks. Some died before or even during evacuations from hospitals. Plus, the Ministry of Health ran out of vaccinations for children back in December 2023.
If you connect all this to the bigger picture, the long-term human cost, especially on the youngest and most vulnerable, it's truly profound, isn't it? It will last generations. So, switching gears slightly, what does all this mean for the efforts to actually get aid in, and what's the wider international response been like?
Well, the immediate challenges of aid delivery are layered on top of a long-standing issue, which is the blockade. Israel's land, air, and sea blockade, in place for over a decade now, since Hamas took control in 2007, has effectively trapped almost 2 million people, isolating them, depriving them of rights. This context is really crucial.
So the blockade existed long before this recent escalation.
Oh, yes. It forced people, like an architect named Aya, mentioned in one source, to innovate using recycled materials, but she believed real expansion just wouldn't happen under the blockade. Fishing is heavily restricted, prohibited beyond 3 nautical miles. That costs fishermen like Sabri, another example cited, their only livelihood.
And basic services were already strained.
Definitely. Electricity outages were common, forcing families to use candles, which itself creates fire risks. So this difficult stage was already set.
Right. That context is vital. So let's talk about the more immediate, the persistent challenges of getting aid to those who desperately need it right now.
Aid delivery has faced, well, numerous obstacles and a lot of criticism. Back in October 2023, Lynn Hastings, who was the UN's humanitarian coordinator for Palestine, stated Israel was opposing aid delivery to northern Gaza. Her visa was later revoked by Israel.
Okay.
Another UN official, Philippe Lazzarini, warned starkly that soon many more will die because of Israel's blockade.
But there were other factors complicating aid, too, from Hamas.
There were reports, yes. A senior Hamas official was quoted saying the tunnels were for us and that the UN could take care of Palestinian citizens.
Yeah.
There are also reports cited of Hamas members allegedly beating residents who were trying to get food aid.
And communication issues.
Big ones. Telecommunications blackouts, some lasting days. The longest reportedly 7 days made aid distribution near impossible, according to aid groups. It prevented workers from coordinating and even reaching the wounded.
What about the process at the crossings?
U.S. senators noted what they called a cumbersome process and arbitrary Israeli inspections that were significantly slowing down aid delivery. UN Chief Antonio Guterres blamed Israeli obstacles and choke points for the delays.
And even security incidents involving aid convoys.
Yes, the UN reported that Israeli forces fired on an aid convoy in central Gaza in December 2023. So multiple layers of difficulty.
So this raises a really important question. With such immense needs on the ground and these persistent, complex obstacles, how have different international actors and even internal voices reacted? What does that spectrum of reactions tell us?
Well, the reactions have been incredibly varied and very strong, often reflecting deeply held positions, as you might expect. Let's start with the aid organizations themselves. They've consistently issued the most dire warnings. Doctors Without Borders describe it as a brutal annihilation of an entire population's health system.
Strong words.
Very. The Red Cross president said what she witnessed was beyond anything that anyone should be in a position to describe. Oxfam called the situation apocalyptic and a living hell. The Norwegian Refugee Council said Gaza was unlivable and called it the worst humanitarian crisis of this century.
Wow.
And Amnesty International put it this way. While the international community is busy pretending Gaza is a humanitarian crisis, Israel continues to violate international law in total impunity.
Okay, that's a very critical perspective. What about the United Nations leadership?
Secretary General Antonio Guterres, as we mentioned, called Gaza a graveyard for children. He warned people were dying, not only from bombs and bullets, but from lack of food and clean water, and hospitals without power and medicine. And he explicitly stated an Israeli assault on Rafah would exponentially increase what is already a humanitarian nightmare.
So very direct warnings from the UN. Now, what about Israeli perspectives? How have they been reported? We need to be careful here to just report what the sources say.
Absolutely. The sources we reviewed show a range of views. For instance, Major General, retired, Jor Island, argued Israel had no choice but to make Gaza temporarily or permanently impossible to live in to secure the return of hostages, though he added it was not a program for revenge.
A strategic argument, essentially.
That's how it was framed. Then you have others, like commentators V. Borrell, who argued the humanitarian crisis itself was being used as an Israeli military weapon and a bargaining chip. And Knesset member Tali Gottlieb was quoted stating, "Without hunger and thirst among the Gazan population, we will not be able to recruit collaborators."
That's a very stark statement.
Yes, and reports from a Knesset discussion, apparently in May 2025, user note. Original script had 2025, likely typo, should be 2024. Keeping as per script indicated some MPs were minimizing the suffering or falsely claiming that blocking aid had led to hostage releases.
Okay, so a variety of viewpoints reported there. How about the United States? Their reactions seem quite complex, too.
Very much so. Early on, in October 2023, the U.S. vetoed a UN Security Council resolution that condemned the violence and urged aid access. The reasoning given was that it was too early and didn't mention Israel's right to self-defense.
But there have been expressions of concern from the administration.
Yes. Vice President Kamala Harris called for international humanitarian law to be respected and stated, "Too many innocent Palestinians have been killed." President Biden himself warned Israel was losing international support due to what he called indiscriminate bombing.
And the U.S. took some direct action on aid.
They did. They started aid airdrops and began constructing a floating pier for aid delivery, though that faced its own challenges.
But then you also have some quite different, more extreme views reported from within the U.S. political sphere.
That's right. Some Republican figures express views reported as extreme. For example, Representative Max Miller suggested turning Palestine into a parking lot with no rules of engagement. Representative Brian Mast was reported as calling Palestinian babies terrorists who should be killed.
Those are shocking statements.
They were widely reported. Former President Trump said Israel needed to finish the problem. And Representative Tim Walberg suggested using nuclear weapons, referencing Nagasaki and Hiroshima.
Nuclear weapons.
That was the reported suggestion. But on the other side of the spectrum, you had a group of Democratic senators, led by Bernie Sanders, calling on President Biden to enforce federal law, specifically to halt military aid to Israel if it continued restricting humanitarian access to Gaza.
So a really wide range of reactions reported from the U.S. What about neighboring countries and the refugee concerns?
That's another critical piece. Egypt closed the Rafah crossing, citing fears of permanent displacement of Palestinians into Egypt, essentially a new refugee crisis. There were reports Israel was trying to convince Egypt to accept refugees. Jordan also expressed a strong reluctance to receive refugees from Gaza.
It really highlights the sheer breadth of these reactions, doesn't it? From those desperate pleas and stark warnings from aid groups, all the way to political arguments that seem to use the crisis itself as leverage. It's just a truly complex tapestry of immense human suffering interwoven with geopolitical strategy, all playing out very publicly. So this deep dive hopefully has taken us beyond the headlines a bit. We've tried to uncover the layers of this humanitarian crisis in Gaza, from the sheer devastation of infrastructure and the massive displacement to the collapse of essential services like water and healthcare, and of course the harrowing impact on the most vulnerable, particularly children. It's just such a stark reminder of how interconnected all these challenges are, and you hear those urgent calls from aid organizations and international bodies echoing through it all.
Yeah, and if we connect this back to the bigger picture, it really highlights that understanding this crisis isn't just about counting casualties, is it? It's about grasping the systemic breakdown of life itself, and also seeing how differently the situation and the responses to it are interpreted and framed politically. It really encourages critical thinking, I think, about how information is presented to us and what the real-world implications are for millions of lives.
Absolutely. So maybe the final thought for you, our listener, to consider beyond this deep dive. Given the unprecedented scale and nature of this particular crisis and the sheer volume of information and, let's be honest, misinformation surrounding it, what might be the long-term global implications, not just for the region itself, but perhaps for how the world responds to humanitarian crises of this magnitude in our very digital, very connected age? Something to think about. Thank you for joining us on this deep dive.